Hello, we are Group 19 and our topic is managing type 2 diabetes. Improving one's diet and their long-term eating habits is an important behavior to have. While there are short-term benefits to short-term diets, making habit changes will truly impact one's lifestyle. This is especially important for those working to manage their current condition with diabetes. Some of these changes can be done by teaching our target audience how to make better food choices or how to cook for themselves.
Target audience includes people with type 2 diabetes. We want to focus on people ages 35 to 55 since the onset of type 2 diabetes occurs when people become older. For example, we have diabetic Daniel, a 37-year-old male in El Cajon, who is diagnosed with type 2 diabetes. He wants to change his diet but doesn't know where to start. He would be a perfect example of our target audience. Supportive Susie is also part of our target audience because she has a diabetic mother and is looking for resources.
Our group's focus is on type 2 diabetes management, so our primary audience is those who suffer from it. Our secondary audience, in turn, would include the support system of these individuals, like significant others, family, friends, what have you. Because our selected channel is social media, and due to its open nature, people with prediabetes would also be able to access this campaign.
We plan to segment our audience based on various categories. Starting broad, our focus is going to be on 35 to 55-year-old adults. This will include both genders. However, we want to focus on our lower income adults. This brings us to our next dimension based on geographics in the San Diego East County region that has a high number of deaths due to type 2 diabetes. For our psychographic segment approach, we will find a common motivational approach by shared lifestyle, beliefs, and priorities in the group to understand what drives a patient's actions. And we will also segment our audience by benefits that are sought after the most, like a healthier lifestyle for the family and to reduce a fear of potential health risk.
For our channels, we plan on using Facebook and Instagram. Facebook is a popular channel amongst our target population and is great for building a community. We will also use Instagram and try to connect people with the hashtag Type2MeToo. By using Instagram, we hope to reach a wider age range that not only covers those in our target population, but even younger audiences that can share our information to older family members and friends.
Our first message is making lifestyle changes can be hard, but remember, your children are always watching. The image shows an adult holding an orange and a donut with a child reaching for the donut. This message has both an emotional and a logical impact on the audience. It's logical because it shows how their actions affect their children's choices, and it's emotional because the adults will be motivated to make better choices for the sake of their children and their health. This message is definitely peripheral in that it's the pure image without any text, but it quickly gets the message across and activates the audience. Making lifestyle changes can be hard, but this message appeals to parents and motivates them to make the right choices so that they can be healthy and set a good example for their children.
This message would have an emotional appeal to the audience. Pregnant women would feel worried and alarmed about the effects that may be caused by their poor diet if they do not already take care of themselves well. They may feel guilty for not taking actions early on to their pregnancy, actions that could prevent a lifelong condition for their children. The statistic from CDC was about births in 2016 and how many of those were affected by gestational diabetes. The percents 2 to 10 may mean nothing at first. However, stating the actual number as 69,918 to 394,587 little lives may have a staggering effect on women and their family and friends who read that message. The statistic goes from abstract terms to more concrete ones. This message leans towards the central route of persuasion because it urges the audience to reflect on the message and to take action.